Hey guys, wanted to take this opportunity to try to explain the clinical practice evaluation of standards and quality assignment. I feel like I'm a little bit tardy at explaining this to you guys, so due to that, I will allow up to an extra week for you guys to submit your assignment. So let's talk about it. One thing I will make sure that I do is provide you guys with an exemplar student assignment of this from the past, basically so that you can see for my visual learners exactly what this assignment looks like and how you can earn pretty much full credit for doing it. Basically, what this assignment is it is worth quite a bit of your grade, 20% of your didactic grade. And I'm really just going to read off of the syllabus here what exactly we're looking for. So it says providing quality care at a reasonable cost. It's one of the cornerstones of nurse practitioner practice over the last couple decades. A number of quality studies have demonstrated that nurse practitioners indeed achieve this goal. However, obtaining quality data can be challenging, especially for nurse practitioners whose practice is often reported under a physician. And it's critical that nurse practitioners take the opportunities afforded by Centers for Medicare and Medicaid Services to demonstrate our quality by utilizing the mechanism provided. The purpose of this assignment is to provide students an opportunity to evaluate specific clinical outcomes and/or standards of care in their actual practice setting where you guys are doing clinicals. Providing the standard of care and assuring quality are keys to demonstrating clinical competence. Further, as part of the profession, this is a skill necessary to monitor individual and practice trends and to function within the current healthcare environment. So a little bit more about the assignment. This is all located within Appendix B, as in boy, of our syllabus. So I want you guys to review that. Basically, first step, review the information on the HEDIS measures, the pay for performance or P4P, the National Quality Forum or NQF, Merit-Based Incentive Pay Program or MIPS, and the Advanced Alternative Payment Models, AAPMs. Then what you do is you'll select 3 evidence-based outcome measures from one of the following. So choose HEDIS measures, P4P, NQF, or MIPS, and then review the literature on your selected topic or topics. A little hint here, if you review previously assigned readings from 664 and 666, this might help you get in a better direction. And you'll determine what current standards are based on the evidence and how to assess the desired outcome from a chart. And there is a blank chart within Appendix B within the syllabus that you can use for this, that you should use for this. You'll review in your clinical a minimum of 10 patient charts in your clinical setting for each of the 3 measures that you choose. And basically, you'll create a demographics table to present your cases or your patient charts. You'll calculate the percentage of your sample that met the goal for each outcome measure. Then you'll evaluate your findings. You'll make inferences as to why your findings are the way they are. So for example, maybe there's a sample issue, maybe there's an access issue, a setting issue, a policy issue, a patient issue, whatever you think, evaluate your findings. And then you'll make suggestions for how the clinical site might address this issue going forward. You'll complete the form for this assignment, responding best you can to all of the questions. Upload your assignment into Canvas. Again, you guys can have a 1-week extension for the due date of this assignment. I can certainly be flexible there. So now I'm looking at the clinical practice standards and evaluation worksheet. This is what you guys are going to be turning in into Canvas. Number 1, it says list the 3 outcome measures you chose and which agency they belong to. Again, did you choose them from HEDIS, P4P, NQF, or AAPM, or MIPS? And then describe the current evidence-based practice standards for your measure and reference where this information came from. Then number 3, present your findings of chart reviews and highlight the pertinent data. And there's a blank table here with 10 slots for you to insert your patients. And then number 4, from your sample, what is the percentage of patients at goal for each outcome? And then briefly, just one sentence, describe your clinical setting. And then based on your knowledge of this setting, interpret your findings. Why do you think you found these results? And then number 6, assuming that there is always room for improvement, which I'm sure there is, make recommendations for improvement or to maintain current achievements. And then the rubric is on the following page. Again, assignments worth 20% of your didactic grade. So to get satisfactory on all marks, we're going to be looking at standard, the measures and source, describing the evidence-based standards, your data table and your findings, the percent of patients at goal, your interpretation of the findings, and then your recommendations. All right, I hope that was helpful. And then again, I will be posting an exemplar assignment for this so that you can compare to your worksheet. And if you have any specific questions after reviewing this video or the rubric and syllabus, please reach out to me and I will be sure and happy to help you out. Thank you so much. Talk to you later. Bye-bye.